Well, let's go to COVID-19 related news tonight, because a neglected and underfunded public healthcare infrastructure system is believed to possibly slow the delivery of COVID-19 vaccines to other parts of the country. This is especially significant, we're told, in rural areas where storage and staffing problems are common. Adding to this then has been vaccine hesitancy in those communities. To speak about how the vaccination drive has progressed in the country as far as rural and marginalised communities, we're joined tonight by Professor of Public Health at the University of Cape Town, Leslie London. Prof, a very good evening to you. Grateful for your time. So, has there been fair and adequate access to COVID-19 vaccines in rural South Africa?
Thank you, Tembikile. So, I would say that varies a lot. So, some provinces have had quite good coverage, mainly through very concerted efforts of NGOs and NPOs working with government. In other settings, it hasn't been quite as good. And we've seen areas where people have actually gone out and been successful in vaccinating because they've invested resources in programs to do that. If you don't do that, well, it's really difficult for rural populations to access services which require them to cross a river, get 3 taxis, spend a lot of money. So we actually have to do something quite active about making sure they get access.
And where are we seeing the greatest degree of need?
Well, I think in some of the rural provinces, which are very dispersed, Northern Cape, KwaZulu-Natal, I know Eastern Cape and Limpopo have done reasonably well. I would also say when we think about rural areas, we also need to think about rural farming areas, because there the obstacles are slightly different. They're not so much geographical and physical, they're also about organizational. Farm workers on commercial farms have very little access to public transport. They're dependent on employers for access in and out of farms. And the authorities really have to work really hard to make sure that farm workers can get access as well.
So you mentioned Limpopo, and the Health MEC there, Popira Matuba, has said over the past few months that what they are doing, especially in rural parts of the province, is relying on traditional leaders to spread the vaccine message. Is that being done in other parts of the country, and is it being done as well, do you think?
Well, Limpopo have done well in that sense. So I presume in other parts of the country, if it is being attempted, there are other obstacles to it. And it's certainly the case that local leadership is essential to getting people to buy in. As we know, if outsiders come into rural communities with messages, it's really hard to expect people to accept those messages at face value. So trusted local leaders are always very important for vaccine success. And I think our services need to work more closely with these kinds of leaders.
What about the use of community healthcare workers? I recall when the first batch of vaccines arrived in the country, the then Health Minister, Zweli Mkhize, said thousands of them would be deployed to every corner of the country, going house to house in some cases, to make sure that people know about the vaccines, the side effects, and that when doses do arrive in their region, they're able to get access to them. Has that happened sufficiently enough?
Well, I think when the former minister announced that, we had high hopes that community health workers would be very successfully deployed, and I think the record has been quite patchy. If you talk to community health workers themselves, they often tell you stories about, being trained but then not being sent out, or being deployed in roles which didn't really enable uptake. So I think it's been quite uneven, and we don't really have a monitoring system. As most people know, community health workers were meant to be adopted, integrated into the health system as core to the primary healthcare re-engineering. That has not really happened successfully, and so we've struggled. And had we had really good community health worker base, we would have done a much better job about vaccination, that's for sure.
You mentioned the fact that there's no tracking mechanism. In the updates that we get from government about vaccinations, many of us often only hear about the daily number of vaccines which have been given to people. Do we need a more detailed breakdown by region and things such as the part of the country, the sort of community?
Well, I would agree absolutely. And I just recently went onto the website, the national database, to see, and it doesn't give you sufficient detail to look at these things. So we're particularly interested in older people who are at high risk. So you might not think 50 is very old, but that's the cutoff in a way. So there's aggregate data, but in fact, it's quite hard to see disaggregated where the real need is. Also, I think the provinces really need access to that data, because they need to be able to identify where they should invest their resources. And the current situation, as I understand it, the department's not actually sharing that data very easily with the provinces so that they can target their campaigns effectively. And that's absolutely critical because a public health response really needs access to data to inform what you do.
What about, Prof, the issue of vaccine hesitancy? I mean, we talk a lot about that in the context of the urban communities that have a voice on Twitter, Facebook, and other social media, and are able to call in to talk radio stations, appear on platforms such as Newzroom Afrika. But have we been able to assess the extent of that in rural South Africa?
So it's hard to say, and there are some reports that really suggest that, in fact, vaccine literacy isn't as severe as it's said to be. For instance, Right to Care published a really interesting report on their work taking vaccination out to rural areas in the Eastern Cape, where they said they arrived in these remote areas and people were thrilled to see them. They were like so happy to get vaccinated, and the comment was, there is no vaccine hesitancy here. So I think that's, it's one particular area and it's one example, so we can't generalize from that. But I think there's a lot of overestimation of the problem of vaccine hesitancy. It certainly is the case we do have a problem, and it's probably the case it's worse in urban areas and it's worse amongst young people, and it's worse amongst people of higher socioeconomic status. We've seen that. But if you look at the international evidence, South Africa is actually not worse than the countries of the north. In fact, we're better. And lots of African countries, there's lower vaccine hesitancy rates reported than for developed high-income countries of the north.
But there's also, I mean, whenever we speak about rural communities and access to public health care and even information that has to do with legislation, as we've seen in the past, there's an almost condescending tone, shall I say, and an underestimation, perhaps, of people's level of knowledge and their understanding of the world in which we exist, isn't there?
Sure. I think for any community, there's often an assumption that they have no resources, they have no capacity or agency. And those of us who've worked with communities over many years realize that there's actually a lot of knowledge, there's a lot of skill, there's a lot of insight that the health services government doesn't have and would benefit from. We just have to find ways of working together to tap that and to give communities the ability to change the conditions which make them unhealthy, or change the conditions which act as obstacles to accessing care. So I think there's a lot more that can be done in that regard. I think the services are trying, they're learning, but we have to have a sort of organisation that's willing to accept its limitations and learn from people who don't have PhDs or high degrees or titles, who have a lot of knowledge.
Professor of Public Health at the University of Cape Town, Leslie London, good to speak to you, sir. Thank you for your time.